Welcome to the visual guide for Reigniting Clinical Supervision. In this short video, I'm going to give you an overview of what to look out for or what to expect from this in-depth online training, especially focused for supervisors and for people who want to self-supervise to improve their work. You will notice that in this course is laid out into 3 different acts. The first act looks at the central idea of what RCS is about, which focuses about the difference between coaching for performance and coaching for development. The rest of the course hinge on these 2 pillar ideas that we'll continually revisit. And briefly, what I would say, coaching for performance is typically at a micro level, looking at one case at a time, helping somebody with a stuck case, and the emphasis is typically on the client. Whereas coaching for development, the emphasis is more on the therapist and is to help them develop a baseline performance, figuring out what to work on before, where they need to go, and also developing a system around it to support the deliberate practice efforts. And in this Act 1, we also peer in and look at the typical mistakes that we make in supervision, some of which relate to self-assessment bias. Another one relates to a general thing about seeing patterns and seeing things when there aren't any to look at. More on that when we go into modules 5 and 7. In Act 2, the actual solutions, that's where we really dive into the weeds, looking at actual practical solutions that you and your supervisees can work towards. The 2 main components. The first is really about the use of measures. The emphasis about the use of measures is really not just some form of evaluation, but using it as a form of conversational tool and not just as an assessment tool. Then we go a little bit further on how to develop clear clinical decision trees on how we make decisions session by session using outcomes to guide our intuition. Then we consolidate those ideas and principles on how to use feedback to feed forward into the work that you do. The second component of Act 2 is looking at figuring out where you are at. And this relates to using numbers to get aggregation of your outcomes and then figuring out the what to work on before the how. And this is where we go into real specific details about a particular worksheet that Scott Miller and I has developed called the Taxonomy of Deliberate Practice Activities. Then we also talk about a new idea called the use of an impact session grid, where we help supervisees have a particular framework, a particular kind of arc to look out for in a session when you're trying to investigate an audio-video recording of your therapist at work. Finally, in Act 3, this is where you and I will zoom out and we will look at a way out, a way of seeing, a new way of supervision. And there are many components that we'll look at that. One of which is looking at developing a system of practice to support your deliberate practice efforts. Another is look at data and how to analyze them, to make sense out of them. The third, we look at key principles, in fact 4 of them in deliberate practice that are essential to the building blocks of your efforts. Then we touch upon other ideas about what it means to be a good coach, using John Wooden, the famous basketballer coach, as a model. And then we talk about different types of knowledge that helps us to see things differently. We will also talk about the circle of development, trying to identify a therapist's growth edge. And then we also talk about common psychological therapeutic factors that are involved in impact of outcome. Now, you will notice that in Reigniting Clinical Supervision, the course is also laid out with the best design principles in mind. For example, if you look at the top where we start, we don't start wide with a theory. In fact, we start with right in the middle in terms of the level of abstraction, or in this case, the ladder of abstraction. We start right in the middle at the heart of what RCS is about. After we clear the pitfalls, we go into Act 2 where we climb down the ladder of abstraction and we look at real practical tips. Then at the end, we will zoom out and look at the abstraction, the macro level, the 30,000 feet of an idea, and see what are the key principles to be mindful of so that we can translate this. So as we go, we will continually revisiting the visual guide that we have for RCS so that you know where we're at, where we've gone, and also where we're going ahead in this course. So stay tuned.